Okay, we're now on 8 minutes past the hour, so we will make a start. Good morning, everybody. My name is Kelly Forbes, and I am the Health and Wellness Coordinator for Oman Insurance Company and Bupa Global. We are delighted to welcome you to this COVID-19 vaccine educational session being hosted today by Dr. Sulaiman Al-Habib. On behalf of all of us, I would like to thank today's speaker, Dr.Aline Khalil, Consultant Family Medicine at Dr. Sulaiman Al-Habib Hospital, for today to join us and help us address our questions and our concerns around the vaccinations. I am personally very excited to learn more about the options available to help us adapt to the new normality of living with COVID-19. If I can ask everyone to keep themselves on mute for the duration of the session, we will welcome questions via the chat box, and there will be a Q&A session after the presentation. So without further ado, it's with my very great pleasure to welcome Dr. Aline Khalil. Over to you, Doctor.
Thank you for your introduction, Kelly. Good morning, everyone. I'm Aline Abi Khalil, Family Medicine Consultant at Dr. Sulaiman Al-Habib Medical Center, Sheikh Zayed Road Branch. It gives me great pleasure to be among you this morning for our talk regarding COVID-19 vaccination. In December 2019, the Chinese authorities have warned the world that a virus is spreading into their communities. Within days, the number of people affected with this virus doubled. Since viruses don't respect any borders, this virus has spread to all other continents. The disease caused by the coronavirus, SARS-CoV-2, which we simply call COVID-19, has been declared as a pandemic in March 2020. The COVID-19 can cause variable symptoms ranging from no symptoms at all to life-threatening. What is our situation today? If we can see, the number of people affected by coronavirus is over 112 million. We have reached the tragic milestone of more than 2.4 deaths. This pandemic is not only a public health crisis. This pandemic is, as well has led to socioeconomic and political devastating effects. People are losing their jobs every day. Several factors were severely affected, starting with travel, hospitality, aviation, textile, luxury retail, construction, and real estate companies. Shall we accept this pandemic as our fate? Definitely not. Humanity has eradicated infectious diseases before. One of humanity's greatest success stories was the eradication of smallpox in 1980, thanks to the global vaccination campaigns. The entire world has the same goal now. Cases of COVID-19 need to go to zero. What can we do to flatten the curve? We have to socially engineer our behavior to act like a social vaccine, and we have to take the vaccine. We should always practice hand hygiene. Soap is a very powerful tool. Keep on wearing our masks, respecting social distance, and acting responsibly. In case we are affected, we need to isolate and inform our contacts. The second most important part is to get the vaccine. The vaccine will help protect us and our families. It will help decrease the spread in the community. In this figure, the blue color represents the people who are not vaccinated but healthy. The yellow color represents the people who are vaccinated and healthy. The red color represents the people who are not vaccinated and sick. As we notice, as we increase the number of people vaccinated, we decrease the spread of the disease. From the outbreak of COVID-19, it was clear that the biggest game changer would be an effective and safe vaccine. The pandemic will come to an end when the world population has immunity against the vaccine. How does the vaccine work? The vaccine will stimulate our immune system to do antibodies that will help us fight the virus. So in case we get the virus, our body is ready to attack it. The vaccines have been developed quickly. So it's normal that people might wonder, are those vaccines safe? How protective are those vaccines? During this presentation, we will address the following questions. How do we know the vaccine is effective and safe? Why should we trust the vaccine? Is there a new technology being used and is that dangerous to me? Will it affect my DNA? When will I be protected? Will we still need to wear masks? What are the side effects from the vaccine? What if we've already had COVID? Different platforms have been developed for the vaccines. Some of them are traditional approaches like inactivated virus. Sinopharm is one example of those traditional approaches. It's the same technique used for inactivated influenza vaccine. Other approaches employ newer platforms such as viral vector. Oxford AstraZeneca and Sputnik 5 are two examples of viral vector vaccines. This technique has been used for dengue fever vaccine. Other platforms such as RNA have never been employed previously for vaccination, like Pfizer and Moderna vaccine. We will go in details through the different types of vaccines. The inactivated vaccines, which Sinopharm is an example, they use a virus that have been killed or inactivated by chemical heat or radiation. Since it's an inactivated virus, it's not a live virus, it cannot give the disease. So it will not replicate in the body. However, it will induce an immune response. The efficacy of Sinopharm ranges between 79 to 86%. This vaccine has been approved in so many countries. Over 40 million doses have been administered. It has been approved in China, Brazil, Egypt, Jordan, Morocco, Pakistan, and the UAE. The RNA vaccines, Pfizer and Moderna vaccines, the RNA technology is new in vaccine production, but the same technology has been used in cancer treatment and has been studied for more than 10 years. The RNA vaccines will give instructions for our cells to make a harmless piece that look like the spike protein. On the surface of coronavirus, we have the spike protein that is crown-like, for which coronavirus was named. The spike protein is found on the surface of the COVID-19 virus. Our bodies will recognize this protein and will recognize that it should not be there, so they will build antibodies that will remember how to fight the virus that causes COVID-19 if we're infected in the future. Will this RNA vaccine give me COVID-19? Definitely not. Will it change my DNA? No, the RNA will not enter the nucleus of our cells. The RNA will disappear within 24 hours.
Doktor, na ano tungkol sa COVID?
The RNA vaccines have used emergency use authorization by the FDA, and they have been approved for use in the US, UK, EU, Canada, UAE, and so many other countries. The efficacy for Pfizer vaccine is 95%. Are those vaccines safe? Safety is the most important priority in vaccine approval. In general, most side effects from vaccine occur within 6 weeks of vaccination. to be more cautious, the FDA required 8 weeks of safety monitoring of the COVID-19 vaccines. Monitoring for safety will continue as well as the vaccine is distributed to the public. To assess safety in general, FDA typically advises a minimum of 3,000 participants are included in the trial. The current COVID-19 vaccine trials included between 30 to 50,000 participants. The FDA is using the same strict standards that it has for decades. No steps were skipped, and 2 independent committees reviewed the results. Those committees are composed of doctors and experts that are not linked to the companies that manufacture the vaccine. Viral vectors vaccine like Oxford, AstraZeneca, and Sputnik 5 are viruses that have had the gene responsible for replication removed. Oxford AstraZeneca is using an adenovirus from the chimpanzee. We remove the gene of the virus, and those vectors will transport the genetic material from the COVID-19 virus. This component is safe for the human body, but still it helps the immune system to react and produce antibodies that protect us from infection. Efficacy of the viral vectors vaccine ranges between 62 and 92%. They have been approved in the UK, EU, Mexico recently by the FDA as well. How do I know that the COVID-19 vaccine is safe? Those vaccines had to go through the same process as other vaccines to test them for safety. That involved running clinical trials with lots of people who volunteered to try the vaccine. And those volunteers were adults of different ages and ethnicities. And during the trials, researchers studied how well the vaccines work and how many people had side effects. The results were reviewed by doctors and other experts, and those experts agreed that the vaccines are safe and effective enough to be given to the public. Even after giving the vaccines, researchers continue to study how it works. Why the vaccines developed so quickly? Those vaccines were developed so quickly because it was an emergency, and thanks to the global efforts of all the world's leading scientists who were focused on a single task. Also, we had nearly unlimited resources from governments, including money, manpower, technology, knowledge, and thanks as well to the large pool of adults who volunteered in the trials. Who should receive the vaccine? Priority is given to people who are most at risk of the infection or people who are at risk of serious complications from infection, and then to the remaining segments of the society. People who are at increased risk include people over the age of 60, people who have chronic diseases, diabetes, heart issues, liver and kidney problems, high blood pressure, obesity, people of determination, frontliners in the public and private sector, employees in sensitive and vital positions, then all the community members over the age of 16 years. In Dubai, the vaccine excluded groups where the nursing mothers, the pregnant ladies, women planning to get pregnant in the near future, and children below 16 years of age, or people who have allergies to any component of the vaccine. Prior to taking the vaccine, please inform your doctor if you have any symptoms, especially fever, if you have any medical history, if you're allergic to any vaccine, any food, any chemical, or any injectable substance, if you're pregnant or planning a pregnancy, if you're breastfeeding, or suffer from any autoimmune disease. Vaccination comprises of 2 doses taken separately, depending on the type of the vaccine. Those doses are given either 3 or 4 weeks apart. The vaccine is given in the muscle of the upper arm. For the vaccine to be effective, it's necessary to adhere to the appointment of the second dose. It takes 1 to 3 weeks after the second dose to be effective and provide you with the necessary immunity. You should know that even after taking both doses for the vaccine, it's important to continue taking all the precautionary measures, face mask, social distancing. Do I need to take the COVID-19 vaccine only once in my lifetime? It's too early to determine how long this vaccine will be effective and the duration of its effectiveness. We need more time to pass, but what we know from the people who were enrolled in the phase 1 of clinical trials, they still have immunity until now. So it's already 6 months and the immunity is still there. What should I expect when I get the vaccine? The vaccine cannot give you COVID-19. You can expect some minor side effects like headache, diffuse body aches, muscle pain, chills, fever, pain at the injection site. Those reactions in general are limited. They are more pronounced after the second dose. Those side effects means that your body is doing its job and making antibodies. Those side effects are common and expected. Those are a small price to pay when we see the efficacy and the protection we can provide for ourselves and for our families from the vaccine. Rarely we have some other serious side effects that, like allergy or anaphylaxis. What should I expect when I get the vaccine? You should get, in fact, the second dose always, because the vaccine will not protect you if you get only 1 dose. And after getting the vaccine in general, you'll be monitored for 15 to 30 minutes to make sure you don't have an allergic reaction. Do we still need to wear a mask after getting the 2 vaccine doses? Yes, even though vaccines work very well to prevent COVID-19, the protection is never 100%, so it's still possible to get the infection. And similar to other vaccines, a large number of people in the community will need to get vaccinated before transmission drops enough to stop the use of masks. What if I already had COVID-19? It's still important to get vaccinated even if you had COVID-19. The vaccine can give you longer and better protection against the disease. Here in UAE, over 5.5 million doses of vaccines have been given. There are around 120 centers in Dubai and 19 in Abu Dhabi that are currently giving the different vaccines. Thank you for attending. Please feel free to ask any questions.
Thank you very much, Doctor. That was really interesting. So we have received a few questions in the chat box. So the first one, can people who take medicine for anxiety disorder be eligible for taking the vaccination? And if not, how can they be protected?
People who take medication in general, taking medication for anxiety disorder is not a contraindication for the vaccine.
Thank you. So the next question that we have is, why are there less deaths in Africa and slums globally when the reverse was expected? Does it affect, sorry, there's another part to that question, Doctor, so I'll let you answer that first.
In general, I'm not able to know the real reason, but maybe not all deaths are recorded and not all cases are diagnosed.
Thank you. Does it affect fertility? And if not, why do they recommend not to have the vaccination if you are planning a baby within the next year?
The vaccine doesn't affect fertility. There is no link between the vaccine and fertility. Even for people who were included in the clinical trials of Pfizer and Moderna vaccine, there is a small percentage of them who got pregnant during the trials. Even people who have coronavirus infection, they are getting pregnant. So your body and either the virus or the vaccine, the antibodies generated by the virus or the vaccine will not attack the placenta. So there is no link and no evidence-based theory or relationship between the vaccine and affecting fertility. The reason why we are asking in Dubai people who are planning to get pregnant within the next 3 months not to take the vaccine is that the clinical trials didn't include pregnant ladies. Until now, we do not know if the vaccine might have any adverse effects on pregnant ladies. That's why in Dubai, they are not giving the vaccine for people who are planning to get pregnant in the next 3 months. However, in the US and the UK, the pregnant ladies can decide whether or not to take the vaccine after a discussion with their doctor.
Great, thank you, Doctor. The next question, should we perform an antibody test before having the vaccine?
It's not recommended to do an antibody test before having the vaccine. However, if you'd like to, it's not a bad idea.
Okay, the next one, does immunity mean that I won't get the COVID virus at all, or would it just give a stronger response once I got COVID after receiving the vaccine?
Immunity means that the vaccine will protect you from developing symptoms, but you might still catch COVID, but it will protect you against severe complications and against hospitalization and against clinically relevant symptomatic disease.
Great, thank you, Doctor. So this one, I think it's more of a kind of statement, but it's a very good one. So I think it's really important to point out that although the various vaccines have different efficiency rates, that really doesn't matter and people shouldn't wait to take the vaccine.
Exactly, 100%. The soonest available vaccine is a vaccine that we had to take.
Thank you. So the next one is, I have currently had COVID for the last 10 days. When can I take the vaccine?
For people who already had COVID, we advise them to take the vaccine. They can wait 90 days before taking the vaccine, because in general, the risk of reinfection after getting COVID-19 is very rare and is very low in 3 months. So once we get COVID, we have immunity for the 3 months. That's why the vaccine is delayed for 90 days. However, if we have already started the vaccination process, we have taken 1 dose of COVID vaccine, and in between we get infected, we will get the vaccine as soon as we recover, if like 21 days have passed from our first dose.
So the next one is, I have a friend who has taken the vaccine, but they later tested positive. Does that mean that the vaccine was not effective?
We always have the same query from so many of our patients. On Saturday, my friend did the vaccine. On Monday, started developing symptoms, and on Tuesday, tested positive. That means that this person might have already had the COVID virus that was incubating. We know that vaccines do not work straight away. So the vaccine will need the first dose will need at least 2 weeks to start giving you partial immunity.
Thank you. So the next one, can someone taking medication for hypothyroid take the vaccine?
Yes, if this person who is having thyroiditis is controlled, sure, should take the vaccine.
And this one is a good one, Doctor. As a doctor, which vaccine do you recommend? Thank you for that question.
In fact, we know that all the vaccines are very effective, and the soonest available vaccine is the recommended vaccine. We know there is a difference in effectiveness. The highest effective vaccine was Pfizer vaccine. If it's available, if you're eligible for Pfizer, take it. Otherwise, take the available vaccine.
Very, very good. Well answered, Doctor. Thank you. So the next question, if I take the COVID vaccine, will the DPI test fail? Or do we need to take a PCR? As I live in Dubai, but we need the test for traveling to Abu Dhabi.
The DPI test should not fail, and we should not get a positive PCR after the vaccine. The vaccine will not give you a positive PCR.
Great, thank you. So the next one, my mum is 86 years old and she has high blood pressure. Is it safe to give her the vaccine?
Yeah, this person is at high risk of developing complications if ever she catch COVID. So she should get the vaccine, and she's a priority to get the vaccine.
Thank you. So the next one, are children less than 16 safe against COVID? Otherwise, why are we excluding them from the vaccination?
The clinical trials didn't include children below the age of 16 years. That's why children were excluded from the vaccination. And the preliminary studies done have shown us that the risk of complications in children were far less than the risk of complications in adults. The children are not fully protected, but they are less prone to develop severe complications from the COVID unless they have underlying immune issues.
Great, thank you, Doctor. So the next one, when do you expect herd immunity with the number of vaccinations done in the UAE so far? i.e., when do we expect the number of cases to significantly go down compared to the current trend?
In fact, herd immunity will depend upon the rapidity of the transmission of the virus. When at the beginning of the outbreak, they stated that in order to achieve herd immunity, we will need at least 60% of the people to get vaccinated. But with the emergence of the new strains coming from UK, South Africa, and Brazil, which have a higher rate of transmission, the herd immunity won't be achieved unless, we don't know exactly the number, but unless 70 to 80% of the people receive the vaccine. Both doses of the vaccine.
Great, thank you, Doctor. So the next question, if we got COVID-19, should we still get the vaccine, or will it affect producing the antibodies? I don't know if that one's been covered, apologies if it has.
People who got COVID-19 still benefit from the vaccine. The vaccine might give them a longer and better protection. Since there is a limited supply of the vaccines, we are asking people who got COVID and didn't receive any doses of the vaccine yet to wait for 90 days.
Great, thank you. So the next question, what does Dr. Aline say to people who do not want to take the vaccine and believe the trials have not gone on long enough, and to test the long-term effects and autoimmune issues? That's a really great question. Thank you.
In fact, we cannot really know what might be the long-term effects, we have seen many drugs going into the market, and then after 10-15 years, they have been withdrawn. But the short-term data until now seems very promising. The side effects from the vaccine are all like mild, and we have had rarely serious events from the vaccine. The risk from the disease is much, much higher than the risk from the vaccine. We have a mortality rate between 2 to 3% with COVID-19, whereas the risk from the vaccine is really negligible.
Great, thank you, Doctor. So the next question, I have suffered before from anaphylaxis. Is it safe for me to take the vaccine?
It depends. Anaphylaxis to what kind of substance. If it was to any component of the vaccine, polysorbate or polyethylene glycol, sure, it's not safe to take the vaccine. She should check with her doctor to what kind of medication or to what kind of substance of chemical was the reaction, and then the decision will be taken accordingly. If she suffered from anaphylaxis, she might be carrying an EpiPen. She needs as well to advise the doctors or the vaccination center where she's gonna go. But first she needs to know what kind of substance it was.
Thank you, Doctor. So the next one I think has kind of been answered previously, but it says, why are doctors hesitant to recommend which vaccine would be better? But obviously, Doctor, we have done that, but please you go ahead and answer that one if you wish.
In fact, I have taken the Sinopharm vaccine because it was the one that was available. So, and as I recommended that if we are eligible to Pfizer, take Pfizer because it has the high efficacy rate.
Thank you, Doctor. So the next question, I had a presumptive positive COVID-19 test result. Is that considered positive, and do I need to wait 90 days before getting the vaccine?
When we have a presumptive positive result, in general, it should be repeated. She's either clearing the infection or she's at the beginning of the infection. In general, yes, she must need to wait for 90 days in order to get the vaccine.
Thank you, Doctor. The next question, Dubai announced that you didn't have to wait to take the Sinopharm after COVID as it is an inactive virus. So I guess the question is that the case?
Excuse me, can you please repeat the question?
Certainly. So Dubai announced that you don't have to wait to take the Sinopharm vaccine after, I guess, you have been positive with COVID as it's an inactive virus. So I guess the question is that true?
In fact, for the second dose, if you have received the second dose and then you have developed COVID-19, you don't have to wait the 90 days to get your second shot. You can take it as soon as you recover, provided that 21 days have passed from the first dose. But for the first dose, as per DHA regulations, if you have already got the COVID-19 disease, we wait for 90 days. Not from because the risk of reinfection during those 90 days is low, and there is a limited supply of vaccines.
And that probably leads very nicely into the next question. Where can I get the vaccine in Dubai? I think this is probably on everybody's lips, actually.
If you're eligible for the vaccine, there are many centers. You can just call the DHA 800-342 or download their app, and you will be scheduled for an appointment. Many centers are giving the vaccine, like Al-Ittihad, Dubai Physiotherapy Center, Al-Hayat Vaccination Center, Dubai Parks and Resorts. So there are so many centers available on the DHA website and via DHA app.
Great, thank you, Doctor. Next question, what is the recommended waiting duration to undertake a COVID-19 antibody test after the second injection?
If you're planning to do the antibody test, it's better to do it like 3 to 4 weeks after the second injection. And we have to know that there are different tests for antibodies. For people who receive the Pfizer vaccine, they might do it at Masdar Labs in Abu Dhabi. For people receiving the Sinopharm, they can do it in Dubai and other centers doing the antibodies.
Great, thank you. Now the next question, and this one has come up quite a few times. If we take a vaccine now, both doses, can we take a different type of vaccine? So for example, if you have the 2 doses of Sinopharm, could you take the Pfizer, for example, later?
I think that it will be still safe to take another vaccine as the next booster dose. In the UK, for people who do not know which type of vaccine was given, they are giving any other vaccine, and they did mix and matching between the vaccines. So there should be no problem in giving another booster of the vaccine, like after the 2 doses, after a certain period of time, to get another vaccine. There should be no problems.
And would there be a waiting period for that, doctor, between taking the 2 different strains?
We're not sure yet. It will depend on how long the vaccine will be protective. As I mentioned earlier, we know from people that were in the phase 1 clinical trials, their antibodies lasted for over 6 months now. So the protection from the vaccine is supposed to be at least 6 months. Still, studies are ongoing. We need more time to pass in order to answer this question.
Great, thank you, doctor. So the next one is, do you think it's better to get a PCR test done prior to having the vaccine?
It's not mandatory to get a PCR done prior to having the vaccine, but it's a good idea to do the PCR prior to having the vaccine.
Great. The next one is herd immunity possible with so many variants?
Is it good to get the vaccine?
Could I just please ask everybody to keep themselves on mute? Thank you.
The vaccines, ongoing studies now are trying to determine the vaccine effectiveness against the new variants. What we know so far, that the vaccine is still effective against preventing severe disease and against hospitalization from the new variants.
Thank you. This is a great question. Is it normal post-COVID to feel that you have aged?
The last year was really very tough for everybody. So it's normal to feel that we have already, all of us, aged, regardless we got COVID or not. We know that the effects of COVID-19, the body aches, the shortness of breath, they might last for a bit longer than the disease itself. We might not feel ourselves until 3 to 6 months after the recovery from COVID. So yes, we might feel a little bit old after COVID-19.
Thank you, doctor. If someone is taking cholesterol medicine on a daily basis, is it okay to proceed with the vaccination?
Yes, sure. Cholesterol medication is not a contraindication for the vaccine.
Great. And someone suffering from bronchial asthma, can they take the vaccine? And if so, would there be a preference as to which one?
Yes, people who have asthma should take the vaccine. The soonest vaccine available.
Thank you. Is there any chance of a false negative result or only false positives? And how can we know?
For COVID PCR, yes, there are chances of false negative. If you are symptomatic, if you're having fever, cough, or have been exposed to someone who's COVID-19 and the first PCR done is negative, PCR must be repeated because yes, there is a risk of false negative PCR.
Great, thank you. What is D-dimer test? My friends have suggested post-COVID it's better to get this.
Dimer test?
Yes.
I don't know.
Okay. From where can I get SARS-CoV-2 vaccine VeroCell?
VeroCell?
Yes.
It's not available here in the UAE. Here the vaccines that had been approved are so far Oxford AstraZeneca, Sputnik 5, Sinopharm, and Pfizer.
Thank you. Is it advisable to take the first dose with Sinopharm and the second dose with another brand?
No, it's better to stick with the same type of vaccine for the first 2 doses.
Why is the second dose of AstraZeneca should be taken after 56 days, while the others are 21 days?
The second dose of AstraZeneca can be taken from 4 weeks onwards. It can be taken at 4 weeks. In fact, in the UK, they tried to just extend the gap between the 2 doses in order to vaccinate a larger portion of the population. In order to decide the gap between 2 doses of vaccine, they do kind of antibody testing and they measure our immune response to the vaccine, considering different gaps. And based on those studies, they put the recommendations in order to give the Sinopharm after 3 weeks, the Pfizer after 3 weeks, and the other vaccines after 4 weeks or even single dose.
Great, thank you, Doctor. Someone got the first dose of the vaccine and they were waiting for the second, but in between they tested positive. Do they need to wait another 3 months to get the vaccine and kind of go back to the beginning?
No, no. As soon as they recover, provided that 21 days have elapsed from the first dose and 14 days from the positive PCR, they can take the second dose.
I am planning to travel abroad. Can I do the first dose before leaving and the second after I am back?
Sure. They can do the first dose before leaving and the second after coming back, provided that they will come back within 3 to 4 weeks of the first dose.
Great. Sinopharm is the only vaccine that does not interfere with DNA, as I understand. Is that true? And is it normal for vaccinations to interfere with DNA? How can this be safe?
In fact, Sinopharm does not interfere with DNA. Even the RNA vaccines, Pfizer and Moderna, they do not interfere with DNA. It's an RNA vaccine, and the RNA will not enter the nucleus of the cell, so they do not interfere with DNA.
Great, okay. If a person has allergy to painkillers, so for example, ibuprofen, can they take the vaccine? We've heard Pfizer is not good if you have allergies, but Sinopharm is better. Is that true?
If you have allergies, it will depend on the type of allergy and the severity of the allergy. Having allergies to painkillers, they should determine what kind of allergy. Is it anaphylaxis or not? In general, it's not a contraindication to take the Pfizer vaccine. If you have allergy if you have mild allergy to painkillers, is not a contraindication to take the vaccine. But that should be checked with the doctor who's following the person to know the type of allergy and if there is any other cross reaction allergies.
Thank you, Doctor. If you have missed the booster due to an issue, Does the process of the vaccination start again, or do you need to wait for some time?
As long as you're in the 12 weeks after the initial shot, the process of the vaccination doesn't have to start again. However, it's advisable to take the second dose as soon as possible.
Great, thank you. Is it safe for lactating mothers to take the vaccine?
In UAE, the vaccine is not given to lactating mothers. But in the US, it is given to lactating mothers after a consent between the doctor and the breastfeeding lady. Until now, it didn't appear to cause any harm in the breastfed baby.
Do we expect to have considerable symptoms after the first dose, second dose? And why would this be?
In general, symptoms are more pronounced after the second dose because the second dose will boost and enhance your immune response.
Thank you. If a person has autoimmune disease, can they take the vaccine?
Autoimmune diseases are not contraindications for the vaccine. They can take the vaccine, sure. However, we don't know how well their immune system will respond and how effective will be the vaccine for them.
Thank you. And next one, would someone with psoriasis or any related skin disease, would there be any effects if they took any of the available vaccines?
They can take the vaccines. People with psoriasis, they can take the vaccine. However, depending on their treatment and their disease severity, we don't know how well the vaccine will be protective.
Great. Now, I think we have got so many questions, which is fantastic, but we will need to make this the last one, Dr. Aline. So, and it's a really good point, actually. I like this one. It's a really nice way to finish the session. So for people that don't want to take the vaccine, what would be your tips to increase our immunity? And how long do you think we can go without having the vaccination?
For people who don't want to take the vaccine, it's just enough to share the death toll, the death mortality from the virus itself, and to show them the amount of people who have taken the vaccine, and to do a small comparison with the countries that are the first to give the vaccine to their countries in high numbers. We know that we had a decrease in the deaths and severe hospitalizations in Israel that have given extensive vaccination to the country. So it's our only way out of the pandemic is the vaccine.
And I hope you don't mind, Doctor, I have a question actually. Do you think that they will make the vaccine mandatory to travel at some point in the future?
We cannot be sure about it, but here in Dubai, from now on, in order to visit any governmental facility, you need either to present a vaccination record or to do a PCR before entering any governmental facility.
Great, thank you, Dr. Aline. So that will bring our session to a close. So thank you so much to yourself and all of the team at Dr. Sulaiman Al Habib Hospital.
Thank you for giving us the opportunity to be among you this morning. It was a real pleasure. Have a nice day, and I hope we will see everybody vaccinated so we can achieve herd immunity.
Thank you, Dr. Aline. So for everybody on the call, I really do hope that you enjoyed the session as much as I did, and it has helped to answer some of the most common queries. If anyone does have any further questions after today, please send those in to me at the email address provided in the chat box. Thank you to those people that did send questions in advance. I do hope that some of those have been covered during the session, but Dr. Aline and the Dr. Sulaiman team will respond to those in due course. So again, thank you so much for everyone to take the time to attend today's webinar. And from everybody that was involved in organising, we wish you the very best of health and enjoy the rest of your day. Thank you so much. Bye-bye.
What shall I do?